Okay, so right now, if we take a look at the autoimmune diseases and what's happening is there's a lot of people that develop autoimmune disease and they really don't know for many years that they have an autoimmune disease, and they go through the healthcare system, and they're very frustrated, and they end up feeling that they're being ignored, which they are. They're not being diagnosed properly. They're being misdiagnosed. They're more confused than ever. They typically even then walk into alternative medicine, and then alternative medicine also misdiagnoses them or simplifies their treatment application to maybe just being a heavy metal toxicity or you know something very simple, and they don't understand that the patient actually has autoimmunity, and then the patient has autoimmunity is basically just suffering, going through this healthcare system with healthcare professionals that aren't really diagnosing them and knowing what to do with autoimmunity. So it's a very frustrating event for most people that have autoimmunity, and it takes many years for them to get diagnosed. This is a comic that I saw that was perfect for autoimmunity. It's a patient that has a lot of symptoms, lots of things going on, and then the doctor puts everything is normal. You're the picture of health, and this is very, very common. So remember, like if you go in for a physical exam, the physical exam isn't going to catch autoimmunity. So let's talk about what happens in an annual physical exam. You're going to get eyes, ears, throat, heart, lung evaluated. Unless you have fully progressed autoimmune disease that's destroying your heart or destroying your respiratory system, your lungs, you're not going to see much. Unless you have progressed rheumatoid arthritis and deformity joints, you're not going to see much. So people that have early neurological autoimmune disease, or people that have Hashimoto's or early Hashimoto's or early stages of autoimmunity, they don't have progressed disease destruction, they're not going to have anything show up on a physical exam. And then if they do labs, the typical annual exam labs is basically a cholesterol panel, a chemistry panel that tests things like protein, albumin, chloride, sodium, potassium, glucose. And for most people that have autoimmune lists, they have autoimmune diabetes or some seriously progressed kidney disease. Nothing's going to show up on the chemistry panel. And they have a CBC, and the CBC for most autoimmune disease patients will be normal. Some will have maybe low white blood cells. That's not uncommon to see, but they'll pretty much say, your blood work and your exam looks normal. There's nothing wrong with you. So that is pretty much the standard approach for most people that have autoimmune disease when they first walk in to get their physical exam. And the patient's confused because they don't know why their brain isn't working. They don't know why they're not thinking. They don't understand why their body hurts. They don't understand why they're having all the symptoms they're having, depending on what type of autoimmune condition they have. So that brings us to, what happens in the healthcare system. And if you have an autoimmune disease, or if you have like a chronic illness and you haven't been diagnosed, it's possible that you may have autoimmunity. And what are some strategies that you should be aware of when you deal with this healthcare system?